Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. With me tonight is Dr. Ernest Glass. He is the director of the Facial Pain Center at the University of Missouri Kansas City School of Dentistry. Ernest, welcome to Kansas City Live.
Thank you. Nice to be here.
Thank you. Facial pain, in this respect, is very difficult and complicated. As a general practitioner, I deal with the more simple, mundane, easy toothaches, the things that we most commonly go to a dental office for problems. If we're having an emergency problem, there's a toothache, we deal with it. But the problem is, in many cases, some problems just aren't that simple. Sometimes they're chronic, they're undiagnosed. Sometimes we're just not quite sure what the problem really is. A headache that lasts for months. Pain when someone chews chewing gum for more than a minute or two, or even longer. Problems that we just can't quite put our finger on. This is what you specialize in, sir, and this is why I wanted you to come on our show today. As a specialist in this discipline, what is the most common problem that you see involving facial pain, and how do you treat it?
The most common problems are what we refer to as TMJ problems.
Right.
Probably 80% of the people we see have those. We also see people who have nerve problems, pain in the nerves. We also see headache problems. And I think basically those are the majority of the different types of facial pains that we see.
Within the treatment mode, what do you do? What do you do for these patients?
Probably the main types of treatment are physical therapies, splints that fit over their teeth to help relax the muscles, medications of one type or another to help with pain, biofeedback, stress management, since we know that stress plays a major portion, major role in the muscle pains, head pains, relaxation therapies, those type of things.
That's very interesting. And I'd like to mention to our people at home, this is a call-in segment, and we would certainly like to have you call us here at KCCP, and the number will appear at the bottom of your screen. And I'd also like to mention, we are not here to diagnose your problems. We are here only to give you information that might be helpful, to put you in the right direction so that you can get help. Again, we're not here to diagnose your problems or solve your problems over the television. But we would certainly like to hear from you, and if you'd like to call us, we would entertain your questions. You know, in the realm of temporomandibular joint problems, a lot of people, that's a term that's been brought about, a lot of people talk about it, but I don't think they really know what it is. We have a sample here that might be helpful to show our people at home just exactly what a temporomandibular joint is, how it functions, and what its relation is to the jaw and the teeth.
Okay. The actual temporomandibular joint is this area right here in the skull, and the way it functions, it tends to rotate when you start to open. It also tends to slide forward as you continue to open, and it sort of rotates sideways and moves in all directions when you chew food.
That's rather remarkable. Most of the other joints in the body don't disarticulate and operate in that factor. That's a very complicated maneuver.
Yes, absolutely. It takes a lot of muscles working in there and nerves working to get everything to function and be coordinated.
Of course, we can't see the muscles here in this case on the sample, but we can get a pretty good idea how the bones actually come together. And I think also for our people at home that may not realize this, there is a ligament or a space that's actually in place between the lower part of the jaw and the upper part where the skull is.
That's right. There's a disc that sits in between there, so there's actually separation between the lower bone and the upper bone there in the jaw.
This is, in fact, where a lot of the problems occur, isn't it?
Yes, the disc can get out of position. It can get bent, corrugated, chewed up, so to speak, over time. Fortunately, that doesn't happen a lot, but probably the displacement, the movement of the disc out of normal position is the most common thing that takes place.
That's very interesting. Again, I do want to remind our people at home, this is a call-in segment, and by gollies, we'd sure like to hear from you. So if you have a question for either myself or especially for Dr. Glass, Director of the UMKC School of Dentistry's Dental Facial Pain Center, please give us a call because we'd certainly like to hear from you. You know, one other thing that's of interest to me, I see several different cases, probably more prevalent in private practice. One case is situations where people have malocclusions, supereruption, situations where they have prematurely lost teeth. For whatever reason, they've lost them, and their teeth no longer function the way they should be. What's some of the things that you do to help these people?
The missing teeth, especially if they're back teeth, can cause some problems in the joint, can cause the disc to go out of position, can cause a lot of strain on the muscles. So we would go in initially, if that's the case, put in a plastic splint over the teeth, which opens the bite up a little bit, allows the muscles to relax and takes some of the loading off the joint itself to let things calm down. And when things had calmed down and the pain had gone away, then the general dentist would go ahead and put teeth in to help things function the way they're supposed to. That's
fascinating. One other problem that I see a lot of times, in addition to teeth that have been prematurely lost, a lot of people have a condition that we call bruxism, which is basically teeth that have been ground down by various processes. A lot of times it's nocturnal or at night. Right. They grind their teeth. I understand that's related to rapid eye movement sleep sometimes. Right. That's my understanding.
That's correct.
In situations like that, where they're having a lot of pressure on the teeth, that must be seriously felt back there where the temporomandibular joint is.
Yes, it can cause, again, discs to go out of place, inflammation in the joint, and that can be aided somewhat with a splint that you wear at night. Right. There are some devices that we have at the school. They're called nocturnal wake-up alarms, and they will actually, they read the amount of electric current that's given off by all the muscles using little sensors.
Fascinating.
And they will go off in a loud siren-like noise so that they will actually wake you up and break that cycle of you grinding your teeth.
And this actually helps prevent, by waking the patient or the individual up, that allows them to know that they're engaging in right. behavior that, I'm really curious about that. It's absolutely fascinating because I just, previous to our appearance here, we went over that and talked about it. That's absolutely fascinating. How good are your results with that? How good are the results?
The results are in the experimental stages right now. What happens, unfortunately, if you wake people up a lot during the night, they get kind of grouchy over time, and so you're forced with a grouchy patient who may not grind their teeth, but so you kind of give up one for the other.
That's interesting. Very interesting. Accidents. Now, severe facial accidents. Let's give an example. Let's say a severe car accident. The individual didn't have their safety harness on, and of course, I make a big issue about that. Anybody out there should be wearing their safety belts and their shoulder belts because it's one of the best ways that we know of to prevent facial injuries, Absolutely. Especially in any kind of an accident situation. By restraining that forward movement during an accident, we can tremendously cut down on this problem. But let's suppose someone has a severe accident, they have facial trauma, their jaw is broken. Now, as I understand, we'll go back to our sample over here. These fractures can occur in any number of places.
Right.
Because of the fracturing and what happens during the emergency treatment, when they're in the emergency room, they're going through all the processes of determining the extent of their injuries. A lot of times, a surgeon will be called in to wire the jaw shut. What are the consequences of that, and what can happen?
Certainly, you'd want to reset the fracture, right. And most of the oral surgeons would do that. Depending on where the fracture is, if it's further away from the condyle, this portion here, chances are that everything will be fine. Sometimes if you get it breaks up into the condyle itself, you may have some problems with the bones fusing later on, or with not fusing properly, those type of things, and resulting pain.
Okay. I understand we've got a phone caller on the line. Please go ahead. You're on the air. Please go ahead. Well, it looks like our caller's not there.
No, I'm here.
Oh, you are? Please go ahead.
Okay, a couple of years ago I had a couple of teeth extracted from a root canal.
Yes.
And I've noticed that whenever I have allergies, that area where they were extracted seems to be, it bothers me more, and there's pain associated with it. And I'm just wondering if it has any kind of relation to the allergies.
Were the teeth in the upper or the lower?
No, they were not. They were in the lower right jaw.
Lower right jaw. I would doubt seriously that the allergies, are affecting the teeth that are missing.
Okay, well, that's interesting. I just kind of noticed it's always at the same time that my allergies have really flared up, that I have a lot of discomfort.
Do you get sinus congestion at that time?
Yes, I do.
When you get sinus congestion, the upper teeth sit in membranes that go up into the sinus area, and you can get an expansion of that membrane so that those teeth will sometimes move slightly and hit before other teeth will, and cause the lower teeth to be more sensitive.
Oh, well, yeah, that's interesting. Well, thanks for your answer.
Oh, certainly.
And thank you for calling us here at Kansas City Alive. Dr. Glass, it is really an amazing thing what we can do for patients these days. A lot of patients that have had TMJ problems have, in the past, have been told they just simply have to learn to live with the pain. But that really isn't necessarily true anymore, because there are a lot of treatment modalities, things that can be done to help these people with their problems. We talked about the splint, the grinding problems, stress-related things. How do you deal with stress-related problems? People grind their teeth when they're under stress, and I think that's something we've generally come to experience with patients. Well, what do we do to help modify those behavior problems?
What we see also, in addition to the grinding of the teeth, is actual clenching, which is probably more serious than the grinding itself. The stress, we have the good fortune of having a clinical psychologist on staff who can help with stress modification, the use of biofeedback to reduce muscle tension. There are some medications that can help with the pain that's involved, relaxation training. So a variety of things that are available to help with the stress factor that we know is there in the muscle problems.
I think one of the most important things is that there is an element of conservatism about this. And we talked about this before. Surgeries, even though they are not necessarily considered, they are held out as, I assume, the last resort. Is there any clinical reason for considering surgeries, and what would be involved with that?
Well, there are various types of surgeries in the joint. There are arthroscopic surgeries similar to what's done on the knee, where very fine needle-like instruments put in, the adhesions, little fibrous attachments in there are broken up and sort of flushed out, and that tends in many cases to allow the joint to settle down, allow things to open up better.
Right.
The reattachments of discs, which were done a lot of times in the past, a lot of the surgeons have found out that the arthroscopic surgery seems to work as well, so they're not doing as many of those. Probably the arthroscopic surgery is being done more than anything else in the surgical approaches, unless you have some massive trauma to the area.
Right.
But primarily that. And at the school, we tend to be very conservative, very reversible type of thing. And sometimes the surgery tends to be more for the patients who tend not to get better, tend to still have pain. It's there as an option for them.
That's very interesting. So the conservative approach, as usual, is the best approach.
I think so.
Okay. I wanted to mention also to our viewers out there that there is a phone number that you can call if you have difficulties, facial pain, a problem you just can't quite resolve, and you're not sure, you know what the problem is, and you don't feel like you've been told or don't have that right diagnosis, something isn't quite right, and you need a second opinion, you can call 235-2160, and you can make an appointment at the Facial Pain Center at the University of Missouri, Kansas City. And I think that's probably one of the best things I can suggest to patients, other than if they're initially experiencing the problem, of course, to see their family practitioner,
Absolutely.
their general dentist, see if it's something simple or something that can be determined. If not, it certainly is nice to know that there's a place that we can send our patients for things that are very difficult for us otherwise to deal with.
Yes, well, we're happy to be in the community and be able to provide that service.
Well, that's super. I think of all the things we talked about, is there anything, what do you enjoy the most about treating patients? Of course, there's the good feeling of knowing that you've dealt with a very difficult situation and came up with some sort of resolution of the problem. But what do you enjoy the most about treating these problems?
Oh, I think, just being able to see the people that come in a lot of pain, perhaps that has been there for many months, and to be able to help them, if not take the pain away completely, at least to knock it down, say 80%, to see that smile return to that person's face, it's a good feeling inside.
Well, that's wonderful, and I think that's fantastic. I couldn't think of a better service for the public than that. And again, I want to thank you all for watching Kansas City Alive and Dentistry and You. Again, I am your host, Dr. Casebolt, and I'd like to again acknowledge the fact that we are here to give you information and knowledge about dentistry. We're not here to diagnose your problems. We're here to help you with the information that you need to know to go get help, so that if you have a problem, you get to the right place, the right person, and we can get you taken care of. And again, I want to thank you for watching Kansas City Alive. I'm your host, Dr. Casebolt, and thanks again.
Stay tuned. When we come back, you'll find out what's on the next Kansas City Alive.